everyone, this is Dr. Jisha from CureSkin. Today we will be talking about stretch marks. Everything that you need to know, why they happen, how to prevent them and how to treat them. If that sounds interesting, then please keep watching. Stretch marks are basically these colored lines or linear scars that appear on the surface of the skin during times of sudden weight change, either sudden weight gain or weight loss. And what happens here is that the integral protein, which is present in our deeper layers of the skin, your collagen and elastin fibers, they are not able to withstand this sudden change and they tend to break and rupture. So this leaves behind these stretch marks. They usually appear around the armpits, abdomen, hips, thighs, groin, and even the back. Unfortunately, yes, stretch marks do have a genetic predisposition. So if your mom or your sister has developed stretch marks during their pregnancy, it is very likely that you will also develop it. Stretch marks are commonly seen when there is sudden weight change, so either sudden weight gain or sudden weight loss. Commonly it is seen in women during pregnancy, it is seen during puberty due to the growth spurts, and if you are into heavy weight lifting, it can also be seen due to the rapid muscle weight gain. And if you are someone who's taking corticosteroid tablets orally, you can develop stretch marks. You can also develop it if you are applying corticosteroid creams for prolonged periods of time without the advice of your doctor. You can develop stretch marks. Another situation where it can be seen is certain systemic diseases such as your Cushing's disease or Marfan's syndrome. You can develop stretch marks. One of the situations that I want to point out here is the abuse of topical corticosteroids. So mainly what we see is patients, when they suspect fungal infection, they tend to go to the pharmacy and buy the antifungal combination creams, which usually contain very strong steroids, and they use it for prolonged periods of time without the advice of the doctor. So this leads to a lot of skin damage and irritation, and it also leaves behind stretch marks. So please do consult your doctor before applying these kind of combination creams, and always get the right treatment from your doctor to avoid such skin damage. Not really. Stretch marks are more of a cosmetic concern. However, my take on this is that there is nothing to be ashamed of stretch marks. They are basically a sign that you know how much your body has been through. So, however, if it does affect your overall self-confidence and self-esteem, then definitely there are treatments available which can reduce their appearance. There are different types of stretch marks, but what I want you to keep in mind are basically two types. One is the fresh stretch marks or your recent stretch marks, which medically we term as stria rubra, and then you have the older stretch marks which are already scarred, which are known as stria alba. So the basic difference here is in the appearance. The recent stretch marks or your fresh stretch marks will appear more red, purplish or pinkish in color, and they are often raised or a little swollen on the surface, and sometimes they are also quite irritating. They can be itchy. The older stretch marks tend to be a little more thinner and they appear more pale or white in color. Sometimes they are flat, raised or even depressed. So these are your older stretch marks. Now the point to note here is that whatever treatment that you do try, most of them give you better results when your marks are still red. So that is the early stretch marks or your stria rubra. So when your stretch marks are in this stage, this is the time to get the treatment done, because this will give you better outcome and better recovery. There are two things that you can try to reduce the chances of developing stretch marks. One is to make sure that if you are working on a weight loss or weight gain program, make sure that the change is slow and gradual so that it gives time for your skin to accommodate this new incoming stress. Second is to moisturize and keep your skin hydrated at all times. This will also help to some extent reduce the formation of stretch marks. Here are a few things to keep in mind when it comes to moisturizing. Avoid hot water baths. Use a gentle soap or a moisturizing shower gel. Make sure to use a thick moisturizer or an emollient regularly, at least 3 to 4 times a day. to hydrate and nourish your skin. Look for products that contain hyaluronic acid, cocoa butter, shea butter, vitamin C, vitamin E, or even Centella asiatica. This will help to nicely nourish and moisturize your skin. Also, do not forget to moisturize your skin immediately after your shower. While your skin is still a little damp, this is the best time to apply your moisturizer. No. Till date, there is no one product or procedure that will completely remove your stretch marks, especially if they are already healed or in the older, mature phase where they appear white. Most of these products are basically hydrating moisturizers, which will moisturize and make your skin more soft and hydrated, but they will not remove your stretch marks completely. When it comes to treatment options, the best person to advise you the right combination of treatment would be your dermatologist, so ensure to check with them always. And it is always best to treat your stretch marks as early as possible when they are still in the initial phase. This will help you get better result and more visible improvement. Your doctor can suggest topical treatment, which includes prescription creams or gels. One of the common ones we suggest are the vitamin A derivatives, which is basically your tretinoin. They come in different strengths and they help to reduce the appearance of stretch marks by rebuilding the collagen in the deeper layers of the skin. However, do note that this cream can be a little irritating and should not be used in those who are planning pregnancy, are pregnant, or breastfeeding. Your doctor can also advise other medicated creams which contain hyaluronic acid, glycolic acid, or even silicones. Keep in mind that creams will take a long period of time to show results and can only reduce stretch marks to some extent. You need to use the creams dedicatedly for at least 6 months to start noticing reduction in the appearance of your stretch marks. Your doctor can also suggest procedures or laser treatment for you. Procedures include chemical peels, microdermabrasion, and PRP. In laser treatments, we do use pulse dye, fractional ablative lasers or non-ablative lasers, and we also use MNRF, which is basically microneedling radiofrequency devices, which help to stimulate collagen synthesis with the help of radiofrequency. Although laser treatments do give better visible improvement than just the creams, still you will not see much of an improvement in just 1 or 2 sessions. You will need to do multiple sessions depending on the severity of your stretch marks. So let's wrap things up. Here are the takeaway points for today. Tendency to develop stretch marks is genetic. If you are looking to lose or gain weight, opt to do so gradually. Regular use of your moisturizers and oils can keep your skin hydrated and supple, thus helping with prevention. Treat the stretch marks as early as possible. This will give you better result and faster recovery. That is, treat it when it is still red or pink in color. Remember that no single cream or procedure will completely remove the scars. Your doctor will be the best one to advise the right treatment options for you, and they may combine topical treatment with a few sessions of in-office procedures for better outcome. Visible changes will take time, so make sure to be patient and follow your treatment for at least 6 to 8 months. Hope you found these tips helpful. Make sure to drop in any doubts or questions in the comment section below. Until next time, stay safe and take care.